Hello everyone, welcome to KNO Academy. Myself Saroja Gosavi, AIMS Nursing Officer. Today I am here to explain Leopold manuals to you all, which is one of the important manual in the OBG, which is being asked in most of the nursing competitive exams. So let's get started. So first we'll see what are Leopold manuals. Leopold manuals are a systemic four-step physical examination performed to evaluate the fetal life, presentation and position of the fetus in the uterus. In the sense, the Leopold manuals, here we are going to mainly do a physical examination on a pregnant mother, where we are going to find with the help of manual this fetal life, presentation and position of the fetus inside the uterus. So here fetal lie is nothing but a relationship of longitudinal axis of the fetus with the relation of longitudinal axis of the mother. And coming to fetal presentation and the position, these are nothing but which part of the fetus is going to enter the pelvis of the mother and its dominating part which are entering into the pelvis. Okay, so these obstetric maneuvers are performed after 26 weeks of gestation. It is when the fetus is matured enough that when you palpate the abdomen, its outline can be easily distinguished. So usually this Leopold maneuver, which we also can call as what obstetric maneuver, are usually performed after 26 weeks of gestation, because by that time fetus is going to be well matured, so that you can feel the fetal parts when you're going to palpate the abdomen of the mother. Okay, so next we'll see the history of Leopold manual, like how it started, who started it, how it came into the practice. The four classic obstetric grips, which are known as Leopold maneuvers, were first described and named after a German gynecologist, Dr. Christian Gerhard Leopold. Since then, it has become an essential clinical skill to assess the presentation, lie, and position of the baby within the uterus. So, during the period between 1846 to 1911, there's a German gynecologist called as Dr. Christian Leopold, who first started doing these four classical obstetrical grips. So after his practice, these obstetrical grips are named with his name, called as Leopold maneuvers. Since it is going to be, it has become one essential clinical skill to assess presentation, lie, and position of the baby within the uterus. We'll see purposes of Leopold manual. So Leopold manual help us to identify fetal position, fetal lie, and fetal presentation. So before discussing what is fetal position, let us understand what is meant by fetal presentation. Fetal presentation is nothing but first fetal part that is going to present into the maternal pelvis. That is nothing but first part of the fetus which is going to enter maternal pelvis. That part may be head. If it is head, then it is called as cephalic presentation. That part may be buttock. If it is buttock is entering into the maternal pelvis first, then it is called as a breech presentation. That fetal part may be shoulder. If shoulder is entering into the fetal mother pelvis first, then it is called as shoulder presentation. So with the help of Leopold maneuver, we can also identify fetal presentation. So next, with the help of Leopold maneuver, we can identify the fetal position. That is nothing but which is described as fetal presentation in relation to the mother pelvis. From that entering part, for example, if head is entering, in that particular head part, which dominating part of the head or which bony prominence part of the head is going to lie exactly in relation with the mother pelvis. So that is, for example, right occipital anterior, left occipital anterior, left sacrum anterior, right sacrum anterior, etc. Then with the help of Leopold maneuver, we can also identify the fetal lie. So as I said, fetal lie is described as where the fetus lies in relation to the mother's backs. Here we are going to see the mother back's relationship with the fetal's backs. For example, if both mother back and the fetal back are in parallel, then that is going to called as longitudinal lie. If the mother back and the fetal lie are perpendicular to each other, then that is called as transverse lie. So if they are not in any kind of particular perpendicular or the parallel, it may be oblique lie. So with the help of Leopold maneuver, we can identify the fetal presentation, fetal lie, and fetal position. Then the other purposes are, we can, with the help of this, we can identify even fetal malposition. So we with the help of Leopold maneuver, we can identify the normal position as well as the abnormal position. So with the help of Leopold maneuver, we can also identify approximate fetal weight and amount of amniotic fluid as well as fetal attitude. Here fetal attitude is nothing but relationship of the fetus body parts. So next we'll see the prerequisites before the procedures. In the sense, what are the things you need to consider before actually beginning to start what? Beginning the Leopold maneuvers. So before performing the Leopold maneuvers, what are the things you need to consider? Okay. So the first point is explain the Leopold maneuvers and their purpose to the pregnant mother. So you are going to explain the Leopold maneuvers to the mother. In the sense, what are the purposes of it? How you are going to perform those Leopold maneuvers on the mother. The next is what? Obtain verbal consent. So you need to take the permission of the pregnant mother to perform these maneuvers on her. So which is going to protect you legally, and it is a right of mother also to know what all the things are going to be happen with her. Okay. The next, ask the client to empty her bladder. The full bladder may affect the palpation process. So you are going to instruct the mother to empty her bladder so that you can make relax the abdominal muscles as well. Then position the patient in supine and leg partially flexed from the knees. That is called as dorsal recumbent position. So after explaining the procedure, obtaining the verbal consent and telling the mother to empty the bladder, next you are going to position the mother in dorsal recumbent position. So as you can see in the picture, so this position is called as what? Dorsal recumbent position, where mother is going to lie in a supine and legs are going to partially flexed. So this is going to relax the abdominal muscles, which helps to palpation process. Okay. So the next thing is ensure the patient is comfortable and relaxed. So you're going to ensure the mother's comfort and the relaxation. Okay. Next, you're going to expose the tummy from xiphoid process till to the pubic symphysis and cover the lower part of the body with sheet to provide the privacy. Again, privacy is also going to be at most important at this while performing this maneuver. So you're going to expose only that area which is necessary to perform the maneuver. So you're going to expose the area from xiphoid process. Okay, from there to pubic symphysis. Okay, then ensure your hands are warm prior to the palpation, as coldness can stimulate the uterine contractions or it may make mother uncomfortable. So you are going to make your hands warm before palpating the mother. Okay, so next, we'll see the Leopold maneuver steps. What are the steps of Leopold maneuvers? So how these are performed? What are the findings you can expect from each Leopold maneuver? Okay. So the first Leopold maneuver is known as fundal grip. Okay. So what is the name of the first Leopold maneuver? It is also called as fundal grip. Okay. So here you are going to palpate the uppermost part of the abdomen. This maneuver answers the questions like what fetal part, that is whether it is head or buttock, occupies the fundus, that is nothing but the topmost part of the uterus. So you all might have studied the anatomy as well as physiology of the female reproductive tract. Okay, so in that we know that uterus has what the parts like fundus, body, and which continues as what cervix and the vagina. So with the help of the first Leopold maneuver called as fundal grip, you are going to palpate the uppermost part of the abdomen. So which will help you to identify what part of the fetus is present in the fundus part of the uterus. Okay, so hence you will note the fetal lie by performing the fundal grip or first Leopold maneuver. Additionally, at this step, fundal height is also can be measured. So now, what you are going to do in fundal grip, you are going to see or you are going to palpate the uppermost part of the mother's abdomen. So which will tell us about what is present in the fundus of the uterus. With the help of, after identifying the what part is present in the fundus, you can easily identify fetal lie as well. So as we know what is fetal lie? Fetal lie is nothing but what is the relationship of longitudinal axis of the fetus with the longitudinal axis of the mother. Okay. Additionally, you can also measure the fundal height with the help of first Leopold method, because you are going to measure or you're going to palpate the uppermost part of the abdomen. So wherever you're feeling the fetal part, at point that point is going to be what? Uppermost part of the mother's abdomen, that tells us about the fundus. So by the fundal height only you can identify what? Fundal as well as gestational week. Fundal height will give you information about as well as the gestational age. Okay, it can be measured using a measuring tape, which is known as McDonald's rule, or just by palpating with the finger breadth. So in first Leopold manner, which is known as fundal grip, you are going to palpate the uppermost part of the mother's abdomen. Okay, so which will tells you what present in the fundus part of the uterus, which will also help you to identify the fundal height, which will gives you the idea about gestational age. So how you can calculate this fundal height? Simply by using the measuring tape, you can measure from symphysis pubis to the till where you feel the that fetal part in the uppermost part of the abdomen, or simply by adjusting your finger by calculating your finger width. For example, if you are feeling that part in at the level of umbilicus, above the level of umbilicus, okay, so at the level of xiphoid process, that give you the information about the gestational age as well. Okay, next, what is the purpose of this first Leopold maneuver? Purpose of the first Leopold maneuver or the fundal grip is to determine the fetal lie and fundal height. So by palpating or by doing the first Leopold maneuver, that is fundal grip, you can determine or you can identify the fetal lie and the fundal height. Okay. So next we'll see how to perform the first Leopold maneuver, that is fundal grip. Here you should know the alternative name for those particular first, second, third and fourth step. Okay, the first step or the first Leopold maneuver is known as what? The fundal grip. So that's why I am repeating the again and again the alternative name of the first, second, third and fourth Leopold maneuver like this. Okay. So how to perform the fundal grip or the first Leopold maneuver? So stand client's right side facing towards her face. So you're going to stand the right side of the mother and you're going to face towards the mother's face. Okay. So warm up both hands. As I said, the cold hands can stimulate uterine contraction or make the mother uncomfortable. So you're going to make your hand warm. Okay. Place both hands over the fundal area. Here fundal area is nothing but topmost part of the abdomen or the uppermost part of the abdomen. So you are going to place your both the hands on the uppermost part of the abdomen. Then palpate from one hand while applying steady firm pressure with the other hand to make it easier to identify the fetal parts. Okay. So with the one hand you are going to apply the steady pressure. So with the another hand you are going to palpate the mother's abdomen. Okay. So that you can easily feel the fetal parts. Okay. Next, so this is how the first Leopold maneuver, that is fundal grip, is performed. As you can see in the image, so you are going to stand the right side of the mother facing the mother's face. Okay, then you are going to place your both the hands on the uppermost part of the abdomen of the mother. Okay, with the help of one hand, you are going to apply the steady pressure. Then begin the palpating with the other hand, so that you can easily feel the fetal parts. Okay, next, what are the findings you are going to get? In the sense, after palpation, you feel something. You are palpating, right? So when you are palpating, you are going to feel certain parts. Okay, so if, according to findings, you are going to get certain results. So that we will see now. If you feel broad, firm, irregular, soft mass, which indicates what? Fetal buttocks. Okay, that is in the fundus. In the sense, you are going to apply the steady pressure with the one hand and you are going to palpate with the other hand. So when you are palpating, if you are feeling what? Broad, okay, firm and irregular soft masses, that indicates what? Fetal buttock is present in the fundus of the uterus, which means that presentation is cephalic. So as I said, the uterus has the parts like what? Fundus, next body, then down it will continue as what? The cervix and the vagina, which is going to enter into what? Pelvis, right? So if you are feeling buttocks in the fundus, means obviously the head is present in the down. So the presentation is going to be what? Cephalic, and the line is going to be longitudinal. So this is the one of the most common normal finding which promotes normal vaginal delivery. Okay. Then if you feel the upper pole is empty, that indicates transverse line. You are feeling nothing in the upper part of the abdomen. You are palpating the abdomen. If you are feeling the broad, firm, irregular, soft mass, that indicates the buttocks of the fetus. That indicates what? At the down part of the uterus, you have the head, which indicates the cephalic presentation, and the lie is the longitudinal. You are feeling nothing in the uppermost part of the abdomen, which indicates what? Nothing is present in the fundus. That indicates a transverse line. Okay. Next, if you feel smooth globular mass which is palatable, in the sense you have to feel only one mass, okay, globular, in the sense which is round one and which you feel smooth, okay, and which is Palatable in the sense bounces between the palpating hands. So as I said, you are going to apply the firm pressure with the one hand, and with the another hand you are going to palpate. Okay. So while doing this process, this smooth globular mass is moving from your one hand to another hand. That is called as what? Palatable. That indicates what? Head, because head can freely move, independently move without the body, from its body. So that indicates fundus occupies the fetal head. So while palpating, if you are feeling the smooth globular mass which is moving from your one hand, which is from which you are applying the pressure, to the another hand where you are palpating the abdomen, that indicates what? The head is present, because head can freely move without the body. Independently, head can be moved. That indicates fundus contain fetal head. It means what? The below part of the uterus or the lower part of the uterus contain what? Buttocks. That shows it is a breech presentation, which is considered as what? The malpresentation, which must be documented and confirmed with the ultrasonography for planning the safe mode of delivery for the mother and the baby. Okay, so if you are feeling the smooth globular mass which is moving, okay, with your one hand to the another hand, that indicates head is present in the fundus. So if head is present in the upper part of the uterus, then obviously the lower part of the uterus contain what? The buttocks. That indicates what? Breech presentation, which you consider as what? One of the malposition. Okay, if you are feeling the firm, small, smooth globular masses, okay, so though that indicate what? Fundus contain the buttocks. In the sense, lower part of the uterus contain what? The head, which is going to be what you are going to consider as for the cephalic presentation. You are not feeling any field smooth globular mass, or you are not feeling any broad firm irregular mass. If you are feeling the fundus is empty, that shows what? The transverse line. Okay, so with the help of this first Leopold manual, we can identify what? Here, with the help of this, we can identify the line as well as the presentation of the fetus. Okay, I hope the first Leopold manual, that is fundal grip, is clear. Okay, so let us move towards the next Leopold manual, which is called as lateral or umbilical grip. The first Leopold manual is also called as what? Fundal grip. Please make the note of the alternative names or the other names of this Leopold manual. So the second name or the second Leopold manual is also known as what? Lateral grip or the umbilical grip. Okay. So the second Leopold manual is called as lateral or the umbilical grip, as I said. So the second step answers on which maternal side does the fetal back is located. So here what you are going to identify. So by performing the second Leopold manual, that is umbilical grip or the lateral grip, it will help you to understand on which side of the maternal side fetal back is located. On the right side of the mother side or on the left of the maternal side, the fetus back is located. So the fetal back is the best location to auscultate its heart sound. So by identifying this, you can also identify the hearts. So hence the aim of this step is to locate the fetal back and the limbs. Okay. So if you are identifying the fetal back at the one side, so it is so obvious that the other parts contain the fetal limbs. Additionally, you can also determine the position like what? Right occiput anterior, left occiput anterior, etc. of the fetus at this step. Okay. So the second Leopold manual is also called as lateral grip or the umbilical grip. So here you are going to mainly locate the back of the fetus and help to identify the fetal heart rate. Okay, or you can auscultate the heart rate of the fetus by locating the fetus back. So if we are locating the one side fetus back, means other side is going to be contains what? The fetal limbs. Okay. Next we'll see how to perform the second Leopold manual. Okay. Start facing the client's stand facing the client as the first manual. So how you stood in the first while performing this first manual, in the same way you are going to perform. That is nothing but you are going to stand the right side of the mother, again facing the face of the mother. Okay, place both the hands on either side of the abdomen between flanks and the umbilicus. So you are going to place your both the hands on the side of the abdomen. Now in the first manual you placed your both hands on the uppermost part of the abdomen or the fundus part of the uterus. Here you have to place your hands on the side of the abdomen, that is between flanks and the umbilicus of the mother. Okay. Then by applying steadily supporting with the right hand, palpate with the left hand. Palpate using deep, gentle pressure in slightly circular motion helps to easily identify the fetal parts. Okay, so how we are going to perform this? Okay, so you stood at the right side of the mother, you are facing the right, face of the mother. Okay, then you have to place your both the hands at the side of the mother abdomen, that is between the flank region and the umbilicus of the mother. Then with the one hand you are going to apply what? You are going to support the one side of the abdomen of the mother, and with the other hand you are going to palpate the mother abdomen. Okay, you are going to apply the deep gentle pressure. The pressure should be deep, but it should be a gentle pressure. Okay, then you are going to palpate in a circular motion so that you can identify the fetal parts easily. Repeat the step on the other side as well as using the opposite hand. For example, if you are beginning with the right hand for the support, if you are supporting the mother's abdomen with the right hand and palpating with the left hand, reverse the process. Now you can support with the left hand and palpate with the right hand. Okay. So this is how the second Leopold maneuver or the lateral grip or the umbilical grip can be performed. So as you can see, you're going to stand at the right side of the mother, facing the face of the mother, and you're going to place the both hand. You're going to place the both hands on the side of the abdomen of the mother. With the one hand, you're going to support. With the other hand, you're going to palpate, which will help you to identify on which side the fetus back is present, on which side the fetal limbs are present. Okay. So now we'll see the findings. In the sense, after you doing such steps, what are the things you are going to get? If you feel continuous smooth structure, that indicates it is fetal back. So when you are either you are supporting with the one hand or you are palpating. If you are getting while palpating, if you are getting a continuous smooth structure, okay, that indicates what? Fetal back. It is the best place to monitor the fetal heart rate. You may use fetoscope, stethoscope, or Doppler to monitor the fetal heart rate. Okay. If you feel irregular multiple knob-like structure, that indicates the fetal limbs. Okay. So if you are feeling while palpating, if you feel the continuous smooth structure, that indicates the fetal back. Okay. If you are feeling the irregular multiple knob-like structures, that indicates the fetal limbs. Okay. So also we will able to identify the fetal body parts from the amniotic fluid and the fetal position, whether it is right occipital anterior, left occipital anterior, and many more. So along with the fetal back location and the limb location, you can also identify what? Amniotic fluid and the fetal position. Okay. If the lie is transverse, head or breech may be palpable from one of the side of the maternal torso. See, if the back is present on the left side or the right side, that indicates what? It is a longitudinal line. Okay. If it is a transverse line, in the sense if the that fetus back, or what you say, fetal's vertebral column is perpendicular to the mother vertebral column, then you are not going to see, you are not going to what? Palpate, or it is unable to palpate the smooth regular surface on the either side. So which indicates what? That indicates the transverse line. In the sense, at the mother's hand or leg side, you can feel the if it is transverse line, head or breech may be palpable from the one of the mother's hand side. Okay. So this is about what? The second Leopold maneuver, that is lateral grip or the umbilical grip, okay, which helps us to identify the fetal back, which on which side the fetal back is located and on the which side the fetal limbs are located, which will also help to determine the position. Okay. Next we'll move towards the step 3, that is third Leopold maneuver, which is also known as Paulink's grip. The next or the third Leopold maneuver is the Paulink's grip. Okay, so the third Leopold maneuver is known as the Paulik grip, which is answer the question what is the presenting part. So with the help of Paulik grip, that is third Leopold maneuver, you can get the answer to the question what is the presenting part of the fetus. So now we'll see why it is known as Paulik grips. Okay, so this step was modified by French gynecologist Carle Paulik in the year between 1849 to 1914. So we have seen Basically the Leopold's maneuver given by the gynecologist called as Leopold. But this third maneuver is modified by the another gynecologist called as Carle Paulik. So after his modification, the third Leopold maneuver is known with his name called as Paulik's grip. Okay, so hence it is named as Paulik's grip. Okay, sometimes the third Leopold maneuver is also referred as the first pelvic grip. Okay, so make the note of it. The Paulik grip or the third Leopold maneuver is also known as first pelvic grip. The aim of this maneuver is to evaluate presenting part into the pelvis and the engagement. So after doing the Paulik grip, or which is also known as first pelvic grip, or the third Leopold maneuver, so it will help to identify the presenting part as well as the engagement. So what is engagement here? Engagement is nothing but whether the presenting part of the fetus is entered the maternal pelvis or not, is located or entered into the maternal pelvis or not. That is called as what? Engagement. In a more specific way, so the largest diameter of the fetus is entered into the largest diameter of the maternal pelvis. That is also called as what? The engagement. Okay, so the third Leopold maneuver is also called as Paulik grip, or it is also called as first pelvic grip. Okay, so after doing this, it will help you to evaluate the presenting part which is going to be entered into the pelvis of the mother and the engagement. Okay, next, how to perform this third Leopold maneuver? Again, stand facing the client's face, same as the first and second maneuver. The same thing, how you stood in the first and second maneuver, like that only you have to stand at the right side of the mother facing the face of the mother. Okay, so wide open your right hand. Okay, then thumb on the side and the other four fingers on the other side. Okay, so this maneuver is going to be performed with the help of one hand. Okay, so most commonly the dominating hand, your dominating hand you can use. So here we commonly use what? The right hand. Okay, so how you are going to hold your hand? You are going to spread your hand, or you are going to open your hand. Okay, spread your hands with thumb at the one side and the other four fingers on the other side. Then with the help of that hand, you want to grasp the lower pole of the uterus just above the symphysis pubis. Okay, so how to do this? You want to stand the right side of the mother facing the face of the mother. Next, you want to widely open your dominating hand, most commonly the right hand. How you want to open this? The thumb side at the one side. Okay, then the other four fingers on the other side. Okay, then with the help of that position of the hand, you want to place your hand above the symphysis pubis and you want to grasp the lower pole of the uterus. Use your left hand to grasp the fundus at the same time. Okay, so with the help of right hand, you are going to grasp the lower pole of the uterus. With the help of left hand, you are going to grasp the fundus at the same time. Okay, then try to move the presenting fetal part between your thumb and the forefingers. So you are going to support the fundus of the uterus with the left hand or your non-dominating hand, and with the help of your dominating hand, you are going to grasp the lower pole of the uterus. Then after grasping the lower pole of the uterus, you are going to feel some parts. Okay, it may be again head, it may be buttocks, or it may be any part of the fetus, and you just try to move that part between your thumb and the forefinger. Okay, so this maneuver usually causes some discomfort to the mother, so be gentle and cautious during this step as you are grasping the both fundus as well as the lower part of the uterus and you're exposing symphysis pubis. Okay, you're grasping that and you're moving your that fetal part into the between your finger and the other finger, the thumb and the other finger, so it will cause a little discomfort to the mother, so be gentle. Okay, so like this, the third Leopold maneuver is performed, which is also known as Paulik's grip or also called as first pelvic grip. Okay. So as shown in the image, with the help of one hand, can you see there? So the thumb is at the one side and the other four fingers are the other side. Okay. The other hand is not shown, but usually you are going to support the fundus with the other hand, that is with your left hand, and with the help of right hand, you are going to grasp the lower pole of the uterus. Okay, so whatever you are feeling there, that part you are going to try to move between your other thumb and the remaining four fingers. Okay, so after doing this, so what you are going to find? Okay, stand facing the client as same first and second maneuver. This we discussed. Okay. So now we'll see the findings of the third Leopold manual. Okay. So if the lie is longitudinal and the presentation is vertex and head is not engaged. So what we are going to basically find in this third Leopold manual is what is the presenting part and whether it is engaged or not. Okay. So if the lie is longitudinal and presenting part is the vertex and if head is not engaged. So how do you feel? You will feel the head of the fetus between your finger and it will be palatable. That is nothing but, so how you are going to position your hand? One side the thumb and the other side the remaining four fingers. Okay. So you are going to grasp the lower pole of the uterus. Okay. Then in between that thumb and the remaining four fingers, if the head, you are going to feel the head of the fetus, okay, in between those fingers and the thumb. And if it is ballotable, in the sense it can be easily moved from your move between your thumb and the fingers. That indicates what? The longitudinal, the lie is the longitudinal, presentation is the vertex, and head is not yet engaged. In the sense, it is not yet entered completely into the maternal pelvis, or it is not yet entered into the maternal pelvis. Okay. So if you are feeling the head between your thumb and the fingers, and if that head is moving between the fingers and the thumb, that indicates what? The head is present, the presentation is the vertex, okay, and the lie is the longitudinal. But the thing is what? Head is not engaged. Okay. The next, if presenting part is engaged, that is presenting part has already descended into the pelvic inlet, you will feel the less distinct mass. In the sense, if the presenting part, the same finding, okay, you are feeling the head between your thumb and the remaining four fingers, but the thing is it is not palatable. In the sense, when you are doing the movement, it is not moving. That indicates what? The presenting part is been already engaged or came down into the pelvic inlet. Okay. If the presenting part is breached, the masses will feel much softer and smaller, and also it won't move independently of the body. So as I said, head can be independently moved with the body. Okay. So while moving the head, it is not necessary that entire body of the fetus should move. But when it comes to the buttocks, if buttocks are moving, it indicates what the other body parts also has to move. Okay. So the presenting part is the buttock. In the sense, if you are feeling the small, much softer and smaller body parts between your thumb and the fingers, so it indicates what? Breech presentation, and it is not going to move independently as it can be moved in the head or the vertex presentation. Okay. Next, if the lie is transverse like the empty fundus, the lower pole of the uterus will also be empty. Hence, the no fetal parts will be perfected. Okay, so these are the findings which you can find by performing the third Leopold manual. Okay, so what are the findings you want to get here? So you are going to, if you are getting the head, or if you are feeling the head between your thumb and the remaining four fingers. Okay, and if that head is moving between your thumb and the finger, that is nothing but the palatable movement is present. That indicates what? Longitudinal line, vertex presentation, but head is not engaged. The same thing, you are feeling the head, but the thing is what? It is not palatable. That head part is not moving between your thumb and the remaining four fingers. So that indicates what? It is already descended. That engagement has been happened and it is already descended into the pelvis inlet. This is in case of vertex presentation. Okay. If there is a breech presentation, so you are going to feel some more like softer and smaller masses in what? Between your thumb and the remaining four fingers. That is the one finding. Then another finding is what? It is not going to be independently moved. In the sense, the you can feel the movement of the other body parts in the uterus of the mother. Okay, if there is a transverse line. Okay, so if there is a transverse line, you are not going to feel anything in the fundus as well as anything into the lower wall of the uterus. So that indicates what? Fetal part is that indicates the transverse line. Okay. So this is about what? The third Leopold maneuver, which is known as Paulick's grip, okay, which will help you to evaluate the presenting part into the pelvis, whether it is a vertex presentation, breech presentation, okay. Along with, you can also identify the lie as well as engagement has been happened or not, okay. So next we'll move toward the fourth Leopold maneuver, that is pelvic grip. Okay, so the fourth Leopold maneuver is known as pelvic grip. This final step of the Leopold maneuver answers the question: is the fetal head engaged in the pelvis, and what is the attitude? Again, this pelvic grip is also going to tell us about the engagement along with the attitude. So here the fetal attitude is nothing but the relationship of the body parts of the fetus. So what kind of relationship is present between the different body parts of the fetus is known as what the attitude. So by doing the pelvic grip, you can identify the attitude as well as whether the fetal head is engaged or not. Okay. So this step will help you to confirm the presenting part of the fetus and it descending into the pelvis. The presentation is vertex, you can determine the relation of the cephalic prominence to the fetal pad to evaluate the fetal attitude. Okay, so with the help of this step, you are going to identify the presenting part and whether it is descended into the pelvis or not, in the sense whether engagement is happened or not. Along with that, okay, if there is an engagement has been already happened, then you are going to see the relation of the cephalic prominence to the fetal back. That is nothing but you can identify the fetal attitude. Okay, so additionally you can determine the degree of engagement, hence confirming the findings of the third manual. So as you can see here, in third manual also you are going to evaluate the engagement. Here you can evaluate the degree of the engagement, to what extent the fetal part is entered the pelvic inlet. Okay. Okay. Then we'll see how to perform the fourth Leopold maneuver, which is also known as pelvic grip. Okay. So in this step, stand facing towards the client feet. This is the only maneuver performed facing towards the woman's feet. Okay. So we already seen the how to perform the third, all three Leopold maneuvers. Okay. So we have just seen the three Leopold maneuvers, how it is performed. Okay. All the three Leopold maneuvers. The common thing is what you have to stand the right side. Okay, the thing is you are facing the face of the mother in all three. Okay, but the fourth Leopold maneuver is the maneuver in which you have to stand right side only, but the difference is what you have to stand facing towards the client's feet. Okay, so this is the only one maneuver which is going to perform facing towards the woman's feet, whereas the remaining three Leopold maneuvers are performed while facing the mother's face. Okay. Place the hand below the umbilicus parallel to the inguinal and walk the finger around presenting part towards the midline and the symphysis pubis. Okay, so you are going to place your both the hands below the umbilicus. Okay, so below the umbilicus parallel to the inguinal canal. Okay, then you are going to like run the finger along the presenting part. So you are going to feel the presenting part from the inguinal area. You are going to run those fingers towards the midline and the symphysis pubis. So as you can see in the image, so you are going to place your both the hands just below the umbilicus. So then you are going to parallel to the inguinal canal, you are going to just run your hands towards the midline of the symphysis pubis. Okay. Then what are the findings you are going to get? Okay. So when you move your hands or the fingers towards the symphysis pubis, if the fingers of the both the hands meet, okay, so you're going to see in the picture, you're going to move the hands towards the midline of the symphysis pubis. So when you move that to the midline of the symphysis pubis, the fingers of the both the hands meet, which you can call it as what converge below the presenting part. That indicate what presenting part is floating, in the sense it is not yet engaged. Okay, so when you bring the fingers of both the hands towards the midline of the symphysis pubis, okay, just below the presenting part, if the fingers of both the hands are meeting just below the presenting part, that indicate what the engagement is not yet happened, the part is floating. If the opposite of it, that is, if the fingers of the both hands diverge, in a sense, when you are moving the fingers of both the hands towards the midline of the symphysis pubis below the presenting part, but the fingers of both the hands are not meeting, in the sense they are diverging. So that indicates what presenting part is now engaged. So these findings you can get through the fourth Leopold manual. So if both the hand fingers are meeting below the presenting part, that is converging, that indicate the part is not yet engaged and the presenting part is floating. Okay, if the fingers of both the hands are not meeting just below to the presenting part, they are away from each other or they are diverging, that indicates the presenting part is engaged. Okay, so this is about how to perform, what are the findings you have to get from the all four Leopold maneuvers, which are also called as obstacle grips. Okay, so this is the first Leopold maneuver, which is also known as fundal grips. Here, the thing you're going to make a note of is what the alternative names of the Leopold maneuver, what are the findings you're going to get, and the images are most important because most of the times in many of the nursing competitive exams, these images are being asked. They're going to give the image and they're going to ask you which Leopold maneuver is being performed on the given image. Okay, so mainly you have to focus the images as well as the which Leopold maneuver it is and what is the other name and what are the findings you are going to get through it. Okay, so this is the first Leopold maneuver, which is also known as frontal grip. Okay, so this is the second Leopold maneuver, which is also known as lateral or the umbilical grip. This is the third Leopold maneuver, which is known as Paulick's grip. Okay. Then this is the fourth Leopold maneuver that is known as pelvic grip. Okay. So along with this, the one more important point which you need to remember is the first three Leopold maneuver are performed by facing the mother's face, whereas the fourth Leopold maneuver is the maneuver where you have to face the feet of the mother. Okay. Next, we'll see the contraindications of Leopold maneuver. Is there any contraindication to perform the Leopold maneuver? Okay, Leopold maneuver should not be performed during the uterine contraction. So that is the one you can say the contraindication. Otherwise, you can perform this Leopold maneuver to the in all pregnant mothers after 26 or 24 24 weeks of gestation. Okay. Next, is there any complications of performing the Leopold maneuvers? Okay, that we'll see. Leopold maneuvers do not have any significant complications. It may cause mild discomfort to the mother, especially during the third maneuver, and somewhere very rare cases, it may trigger even uterine contraction. Okay, so there are no any such complications are seen when performing the Leopold maneuvers because it is non-invasive. Okay, minimally time-consuming procedure. You're not going to use any devices here. Okay, you're not going to. This is not a invasive procedure, so it is not going to cause any complications. But still, in the third Leopold maneuver, where you are grasping the lower pole of the uterus, that may cause some discomfort to the mother. And if your hands are like too cold or it is not warm, then that may trigger uterine contraction in rare cases, not in all cases. So we make sure that you are going to meet the all prerequisites which we discussed earlier. Okay, so this is about the Leopold maneuver, which is one of the important topic or one of the important obstetric maneuver, which is being asked in most of the nursing competitive exams. Okay, so here image-based questions or the images are important. Alternative names of the each and every group is important. Okay, so I hope this video is helpful. Stay tuned with KNO Academy for such more videos. Thank you.